So, can you tell us a little bit about the use of morphine kind of in the hospice patient and how sometimes it gets a bad rap from movies or social media or things like that, but why is it important for us?
Oh, okay. So one of the key elements of hospice is managing pain. And by the time they get to us, they've already used a lot of the other medications to try to manage pain. So we are at the point where narcotics, and morphine is a narcotic, is needed to manage pain. It also manages breathing issues. So it's a very versatile drug. It is the oldest of all our opioid drugs, outside of heroin, which we can't prescribe in the U.S. So we use it quite frequently. It's relatively safe in the amounts that we use. We manage it quite closely. We use it for both long acting, which means to keep a baseline pain management, as well as short acting, with the idea being that once somebody has their pain under control, they're going to feel better, so they're going to sleep better, they're going to eat better, and they may be able to communicate more and interact a lot better. What people don't realize is that all the side effects of morphine go away, with the exception of constipation. So, that's why we treat that. But every other one, the tiredness, the upset stomach, the itchiness that they get on this, all those will go away once the medication's on board. The other fear, I don't know if you hear this, but I've heard this a couple of times. People are like, I don't want to take that because I'm afraid I'm going to get addicted. Well, we've learned a lot about addiction over the years. And one of the things that we've learned is that when you've got true pain or true dyspnea, their chances of addiction are really, really low. Addiction is a whole disease set of it on its own. So if there's not an addiction issue in the family ahead of time, it's not going to be a problem at the end of life. Yeah. So it's more about being able to maintain their symptoms, maintain their comfort, so they can have that time to enjoy their family and do what they need to do before they die.
Yeah, thank you.
So.